Are you dreaming of the perfect nose? Well, before you have your rhinoplasty, there's information that you need to hear. While rhinoplasty is one of the most popular procedures worldwide, it is also one of the most complex, both in healing and to perform technically. Even small changes in your nose can have major consequences if something goes wrong. Hi, I'm Dr. Sarah Saxon, double board certified facial plastic surgeon, and I've done thousands of rhinoplasties, and I've learned that the key to successful outcomes is learning what can go wrong and addressing it ahead of time. Today, we're pulling back the curtain on rhinoplasty complications from breathing problems to asymmetries. We'll be talking about the full spectrum of what can happen after your surgery. I'll also talk about real patient scenarios so that you can get a good idea of what to expect during your recovery from a rhinoplasty. Whether you're just starting your research or already have your surgery date, this video will be important for you to watch all the way through so that you are fully prepared for what to expect after your procedure. The nose is a very complex structure, and one thing to note about the nose is that it's very vascular. So there is a risk of bleeding after surgery. I expect you to have some oozing in your nose the first 24 hours. The nurses in the recovery room will actually put a drip pad underneath the nose to catch any of that oozing. You have some raw surfaces inside the nose after surgery, and those have to seal up with your body's own natural clotting factors. If you have any bleeding disorders after surgery, this can be a problem. So we have to know that ahead of time to enable us to leave packing or splints inside the nose, which I don't typically leave. I did have one situation where I had a patient with something called Ehlers-Danlos syndrome, and it's a collagen vascular disorder. And he desired a rhinoplasty. And so we had an upfront conversation about things that could happen in the healing process, like prolonged healing or bleeding. He ended up having some bleeding after surgery where I had to place some Vaseline soaked gauze in both sides of his nasal cavity. So he had to stay on antibiotics throughout that time. The gauze was able to put pressure on the tiny little blood vessels that wanted to continue to ooze, and he ended up being just fine. There is an artery in the back of the nose called the sphenopalatine artery, which isn't encountered during a regular rhinoplasty, but there are small branches from that artery that can be throughout the nasal cavity. And so we want to make sure that your bleeding is controlled at the end of surgery. But as the local anesthetic wears off after your surgery, the epinephrine or Afrin that's used to constrict those blood vessels to make it easier during your surgery can wear off, leading to those vessels slightly opening up. And that's where you can get a little bit of oozing afterwards. If only some light bleeding is encountered, that's okay. That will eventually stop. If it does continue, the first thing you'd need to do is spray some Afrin on both sides of the nasal cavity and hold a little pressure. This hasn't ever really been an issue for me, so usually by the next morning, all of that has stopped. As with any surgery, infection can occur after a rhinoplasty. The one thing that's different in nose surgery versus elsewhere is that you can't completely sterilize the inside of your nose for your surgery. So there's lots of bacteria in the nose. It's where allergens, things in the air will pass first before it gets into your immune system. So we constantly have lots of bacteria and sometimes resistant bacteria in our nose. Because of that, I have you on some antibiotics after surgery, and I found that this decreases inflammation. The good thing is, because the nose is so vascular, having an overt infection after rhinoplasty is very rare. This can be increased if you're having a revision rhinoplasty because you have scar tissue already present and some of the blood supply is limited on your nose. So the more rhinoplasties you have, the more chances that all of these complications may come about. Scarring can be a major complication from rhinoplasty, and this can be a little unpredictable. We expect that with any surgery, there can be scarring internally, but because the anatomy of the nose is so complex, some of the scarring after rhinoplasty can cause cartilage to shift or move and can cause some contour irregularities. If you have very thin skin, some of the scarring can be really apparent, even if there are only small changes or shifts underneath the skin. And this leads me to my next complication, which can happen is asymmetry. And it doesn't matter how perfect your nose is on the surgery day on the table. If you don't heal correctly or if there's a lot of scar tissue, it can pull your nose from one side to the other or cause contour irregularities and asymmetries that weren't there before. If you had asymmetry before your surgery, which we all have little asymmetries, but if you had a very crooked nose beforehand, there's memory to cartilage and bone, and sometimes your nose will want to veer back in the direction that it was before. So I'll give you some pointers to perform lymphatic massage and help retrain that cartilage to go back to where we want it to be. I keep a lot of structure underneath the skin of the nose. I add cartilage grafts so your nose is a little bit more stiff after surgery. And that's because I want your nose to be able to withstand the forces of all that scar tissue wanting to pull things from side to side. After your rhinoplasty, you can also have prolonged swelling, and this will be more apparent in those with very thick skin or those who have had revision surgery. Those with thick skin can have a lot of swelling, particularly on the tip of the nose. Up here, where there's mostly bone, that heals pretty quickly. But on the tip of the nose, you have lots of lymphatic blockage from the incision, which is at the base of the nose. Plus, if you have thick skin, that can just stick around for several months. The vast majority of swelling goes down in the first 3 months, but it can continue to be present over the course of even a year or even more. With revision surgery, I expect that you won't see your full results until about the 2-year mark because it takes that long for all the swelling to go down. Some things that can happen after rhinoplasty are all inside the nose and you don't see externally. One thing is septal deviation. During your rhinoplasty, I typically take cartilage from inside the nose from your septum in order to add more structure to the outside of the nose. And so, if there's natural deviations in the septum, oftentimes taking that cartilage graft will fix a septal deviation. If you already have existing septal deviation, even if I straighten it out completely at the time of surgery, like I said before, it can have a memory to it and push back over. And even if you didn't have a septal deviation before surgery, if there's a suture that dissolves too quickly, or if you bump your nose, or anything like that that can come up in the course of you healing, can shift the cartilage over a little bit, causing some nasal obstruction. You can also get something called a septal hematoma, which means a collection of fluid between the lining of your septum. So your septum has basically 3 layers in a sandwich. You have mucosa, you have cartilage, and another layer of mucosa. We remove some of the cartilage in between in taking our cartilage grafts. I typically put sutures to sandwich the mucosa back together so that it's adherent to each other. So it doesn't create an empty space where fluid can accumulate. If you're too active after surgery and your blood pressure goes up, it can force fluid into that empty space, causing a collection. Either fluid, meaning a seroma, or blood, being a hematoma. What this can do is limit the blood supply of the mucosa of your septum, leading to a septal perforation, and that means a hole in your septum. If the hole in your septum is farther back, doesn't really have any consequence. You wouldn't even know that it was there. If it's towards the front, it can lead to drying inside your nose or even a whistling sound when you breathe. So we want to prevent any kind of perforations, which can even be at a higher risk if you're having a revision surgery. As I said before, all these risks go up with revision surgery. I have even seen septal perforations with something called Doyle splints. And those are the silastic splints that we put on the inside of the nose after rhinoplasty. I don't use them anymore because I've seen this. If the stitch to hold those Doyle splints in place, which is in the front of your nose, is too tight because of the swelling with surgery, it may not be too tight at the time of surgery. After you swell up, it can constrict the blood supply to the septum, leading to a perforation. So I steer clear of those Doyle splints, which is much better for you because it's much easier to recover from a rhinoplasty if you don't have splints or packing on the inside. You can have something called nasal obstruction after surgery, and this can be the case even if structure on the inside of your nose is fully open. So if I examine your nose, it can look like everything is clear and straight and open, and you still may not feel like you can breathe out of your nose, at least temporarily. And that's because lifting up all the lining of the inside of your nose can cause a little bit of numbness on the inside. So when we sense airflow through our nose, we're actually sensing the coolness of the air going through. So we want to stimulate those cool receptors. Initially, some of that cool receptors may not be active because we have numbness on the inside. But what I find is something called Poneris oil or eucalyptus oil can help trigger those cool receptors. So while you're healing, it can actually trick your brain to be able to sense those cool receptors activating as air flows into your nose. This is the same way that Vicks Vapor Rub works. It's actually eucalyptus that triggers cool receptors, helping you breathe a little bit better or having a sense that you can breathe better. You can have true nasal obstruction in your nose, meaning that there's swelling or blockages either from asymmetry or whatnot or allergies that can cause obstruction as well. If you have allergies, this isn't treated by rhinoplasty. You still have to use things like Flonase, allergy medications, or even allergy shots to help with that because rhinoplasty does not treat the medical condition of having allergies. While you're healing, you can also have weird sensations like changes in your smell, foul smelling things, or just not being able to smell at all. And this is mostly from swelling from surgery. You can have also something called synechia or scar tissue, which can happen if there are raw surfaces up against each other. They can scar together. So the turbinates are structures on the outer part of the nose on the inside that that can swell and contract based on the day, something called the nasal cycle. If you have a raw surface on your septum, it can form scar tissue between the septum and the turbinate, and that's what's called a synechia. To fix that, you actually have to take a scalpel and divide the synechia and place a little splint or packing in between those two surfaces while they heal so they heal apart. It's something that we can see with a camera after surgery if it's a problem. Generally, I don't have this problem, but it can occur with any nose surgery, whether it be sinus surgery or rhinoplasty. Another rare complication, but something that has to be addressed, is a CSF leak. So the septum is actually connected in the back to your skull base. So if a surgeon is too aggressive in handling the septum, particularly in the back where there's a bony septum, you can actually create a little crack in the bone of the skull base. And so we're really careful to make cuts in the bone in the front instead of just manually trying to remove pieces of bone. That prevents CSF leak, but there's always a small risk anytime you're manipulating the septum of a CSF leak. And that what that means is that you would have fluid drain into your nose that kind of tastes really salty. We would catch that really early and have to watch you and potentially even admit you to the hospital if that were to happen. So, I've never had a patient with CSF leak after rhinoplasty, but it is a potential complication. Some things that can happen too are, especially in the bony dorsum here, if I reduce a big dorsal hump or a big bump on the top of your nose, that bone has to heal. And I like to say if you were to break your arm, the two pieces of bone have to come together, and where those two pieces of bone meet, have an area of thickening called a callus. There's nothing different with the nose. There's two nasal bones, and where they come together have to heal. So sometimes, particularly if you're putting weight on the dorsum, like with sunglasses or with regular glasses, it can thicken in that area a little bit. If it's just a slight thickening, I can usually use a little tiny file that I have in the office, numb that area up, and just slightly file that area just to tweak it a little bit. If it is severe, then it would require going back to the operating room to smooth the dorsum out a little bit more. I usually have you wait about 6 weeks before putting any pressure on the nose with glasses or anything like that. The last thing that I like to warn patients about with a rhinoplasty is something called a saddle nose deformity. And that is a very severe deformity after a rhinoplasty where too much cartilage is removed from the septum, and so it doesn't have support enough to hold up the nose anymore. So the nose basically completely collapses. I haven't had this happen in any one of my patients, but I've had to correct it a lot. And it's complicated to fix. I usually have to take rib cartilage to fix a saddle nose deformity, but you basically have to completely rebuild the nose. The nose is kind of like a building where the structure holding your nose up is kind of like the buttresses of a building or the walls or the framing of the walls. And so you need adequate support. Otherwise, the whole nose is going to fall down. So we make sure to leave plenty of cartilage left in your septum to maintain support. If I have to gain any more cartilage for my regular grafts, and then I don't have enough in the septum, I'll usually go to the ear, take this ear cartilage from behind the ear or rib. In a primary rhinoplasty or the first rhinoplasty you have, that's pretty rare that I need to go to those other areas. But in revision rhinoplasty, I generally need to take cartilage from other areas besides the nose. Those are the main potential complications of rhinoplasty. If you have any questions, please don't hesitate to reach out to our office at 512-537-4191. And don't forget to like and subscribe for more helpful information.